For more than a year, the majority of Rhode Island teens have spent hours sequestered in their rooms, coping with isolation, a lack of socialization, and COVID-related anxiety. While some area schools have made a return to full in-person learning and plans for others to follow soon, the pandemic life so far has caused a number of setbacks for this vulnerable age group.
We're still in crisis mode. People are still really struggling.
Dr. Reichenberg is an adolescent psychiatrist at Butler Hospital in Providence. He treats adolescents between the ages of 12 and 17 who are dealing with anxiety, depression, or addiction. Over the course of the past 12 months, 12 News has checked in several times to monitor the status of inpatient bed availability. Normally, there are times when the census waxes and wanes. Currently, that is not the case.
Our services have been incredibly busy and full. We've been kind of, filled to the brim and pretty consistently. Normally, pre-pandemic, our wait list was maybe a few weeks at most, but we're having several month-long wait lists to get into our program. We've been constantly full at 15 with people waiting for days and days in the emergency room to come waiting for a bed in one of our programs.
Now, as the 1-year mark has passed, inside the school, psychologists are still taking on an increased caseload and have seen a staggering increase in the number of students and the kind of students who are in need of help. Coventry High School psychologist Lou Ruffalo shared this chart showing a triangle of intervention and support with 12 News, a stunning reminder of how much the pandemic truly has impacted teens and their mental health.
What we've seen now is it's completely flip-flopped. So we've got just about 80% or so of the students who require some pretty intensive help and supports. And it's a challenge for us.
Those challenges adding complexities to the ongoing effort for Coventry High School to become an official trauma-informed school district. Ruffalo telling 12 News they're already adapting to the changing needs of students during this time of transition.
One of the things that we're going to need to do is more parent engagement as we move forward. I mean, we're in unprecedented times. And so, that's something that has been used for us to better understand how we deliver supports and services.
And as Dr. Reichenberg and Butler Hospital staff continue to support these teens in crisis, he's tracking a common thread that most teens and their families can relate to.
Definitely a shared sense of grief and loss around things that they couldn't experience, like I alluded to before. Missing senior year is a really common challenge. Not seeing their best friends and even their romantic partners, certainly a challenge. Seeing friends struggling, seeing friends and family struggling. I mean, I'm seeing having a lot more of my patients share with me how they're picking up on family strife at home, whether it be financial or relationship with their parents, and so it's hard.
Certainly the setbacks of the past 12 months are clear, but there are some pandemic success stories out there. There's also a growing sense among our mental health experts that there are concrete solutions that can help these teens to continue to nurture their mental health and succeed as they move forward.
Sometimes there are students who in schools might typically struggle because they had pre-existing anxiety or they struggled socially. And so for them, it was a little bit easier for them to simply focus on their academics.
And Ruffalo is trying to focus on how resilient so many of these teens have been during the toughest year of their academic lives.
You made it through. That's the important thing. And if you can manage this, what can't you manage? If you can take some of what you learned in terms of your strengths and your ability to be resilient with you, you're going to be successful.
And here are some of the ways parents can help with a successful transition back to full in-person learning. Take a moment to acknowledge making it through this difficult time. Everyone deserves credit for getting to this point. Information is power. Understand the process and the expectations for students moving forward. Get your questions answered if you have any so that you're comfortable with the process. Keep the lines of communication open with your kids. Ask them how they feel about going back to school and if they're worried about anything. Sometimes the things that they're concerned about are not what parents would think teens would be worried about.
Validating for your kids that yes, we realize this is going to be a challenge. This is really hard. We're in this together. And we're going to have to try to be flexible.
Helping teens get organized will help to declutter their minds as well. And experts also suggest helping teens get better sleep hygiene habits.
They're falling asleep later and they're waking up later. And that's going to be a challenge getting back to school. And so I would really strongly encourage people to start thinking about slowly inching, very incrementally, slowly inching their sleep hours back to normal and practicing basic sleep hygiene.
Parents also expect that many schools will be reaching out to you as they're trying to be more proactive with screening what students may be in need of regarding their mental health moving forward.
I've been working on trying to reach the most number of students as possible by putting out information with the faculty directly to students. We've done a lot more outreach for students who are struggling with both academics. We've been screening parents and having them be able to request help.
And perhaps the easiest and most natural form of help is on the way. Warmer and sunnier days to help get more teens outside and more active to help their overall well-being.
As kids get back to school, as summer rolls around, as the weather gets nicer, as people start to get more sun. Hopefully, people can go outside now because it's nice out. People are able to get more physical activity. People are going to start to socialize more. So I am very hopeful.
I'm Danielle North, 12 News.